And let's turn now to the care and support that patients can access. And I understand you're very fortunate at Macquarie University Hospital to have a McGrath breast cancer nurse. Dr. Sedaghat, can you tell me about the importance of that role?
I think it's absolutely crucial, and this is really with much advocacy and involvement from our patient groups, notably the McGrath Foundation. Really, what they identified was that no patient who is diagnosed with breast cancer should ever feel alone in their journey. And the breast care nurse provides that support, not only in terms of information and education, but also in terms of that emotional support as well. They see the full range of patients who go through an equally full spectrum of breast cancer from the very early stage to extremely advanced stages. And they're so well informed of the pathway and the options for treatment that I feel that patients have this port of support and a port of call where they feel comfortable to ask any question from their breast care nurse. And they don't feel at any point that they're alone in that journey. It's a time of increased vulnerability for patients. And I think the breast care nurse plays an incredibly vital role in that.
You spoke earlier about the importance of a multidisciplinary team. Can I ask you, how much has breast surgery evolved during your career?
The surgical techniques that we use in breast surgery have evolved, and surgeons are at the front line of that. And really, it is the responsibility of the surgeon to inform patients about their options. But as more and more patients become aware of these options, and our patient support groups and networks advocate a lot more, they become more informed about these new methods and techniques. So, one of the best examples of this is breast reconstruction. And in the beginning of my training, really, as breast surgeons, we weren't doing that many breast reconstructions until the advent of oncoplastic breast surgery came through. And there were a number of pioneers throughout Australia who really began to offer this to patients, and were training breast surgeons in those techniques. And I was fortunate to be one of those as well, to receive that training. And so it meant that we were now having discussions with patients about the option of having an immediate breast reconstruction at the time of mastectomy. And now this has become a standard of care approach where we discuss that with every woman, regardless of age, as well. And so what I found was that in the beginning, women were not aware of this option. But now many, many more women are aware, certainly in metropolitan centres.